Hey, what's up guys? This is Dr. Michael Coe, physical therapist, and what I'm going to do is I'm going to show you some techniques you can use to try to help out your elbow pain. I already have a prior video where I show you how to use your hands to be able to stretch out certain joints with your elbow. I'll go ahead and list that on list that below. But what I want to do is I show you some non-joints of more muscular self-massage you can do to try to help out with elbow pain. Now, here's something I want you to remember. I just said the word elbow pain. I didn't list a specific diagnosis like tennis elbow or golfer's elbow. It's probably your most two common elbow injuries for people. Now, the reason why I said just generalized elbow pain is that you got to remember that there are certain techniques, certain strategies, certain exercise protocols you might use for a specific injury. And that's very specific to that specific area, that injury, that body part, right? But there's also a lot of overlap of different exercises and different manual techniques you can use for any of those things because we're talking about a certain region, right? So if you want to get more specific, tennis elbow is going to be what we call lateral epicondylitis. Golfer's elbow is what we call medial epicondylitis, right? But you got to remember that if you had tennis elbow, you're not only just going to work on the muscles on the outside right here, because those muscles that attach to the wrist extensors and the finger extensors attach to where that area of pain is. But you gotta remember, as when the arm and the hand is functioning, all the muscles, whether it be the backside or the front side, is gonna be active. That's gonna be contributing to your pain back here. And vice versa. If you have pain that's coming out with your finger flexors and that's coming to this medial epicondyle, where you would call tendonitis of that inner elbow or golfer's elbow, right? There's still a lot of things that could be dysfunctional on the other side. So whether you have either of those two types of elbow pain, right, this should be able to help out a little bit. All right, so first thing what I want to do is show you some self-massage techniques to be able to do to yourself. First, I like to use cocoa butter, right? So it doesn't matter what kind of lotion you use, but I like to use one that's more oil-based, and the reason why is it doesn't evaporate super quickly. If you use a water-based lotion, what'll happen is you'll do like 2 or 3 strokes, and all of a sudden it's super dry, right? So I want there to be this sliding surface that you don't have to constantly reapply over and over again. So I'll send a link of where you can purchase this on the notes also. And also what you want to do is you want to use a little bit, right? So you don't want to just get this giant glob and just put all over your hand, right? You want to use as little as possible to be able to get a skin slide, all right? If your entire arm is super shiny, you did too much, right? So what I want you to do is I want you to focus on trying to do your own self-massage along bones, right? So you have 2 bones, right? You have your radial bone right here, right? And then, the radius right here, and then you also have the ulnar bone right through here. So what I want you to focus on is actually the inner part right through there. So analogy I'll use, if you ever eat chicken wings, the one with the 2 bones, it's that middle part of the meat. Sometimes you might stick your tongue to push out, is what I used to do as a kid. You want to hit those muscles in between the bones on both this front side and also this back side. So I'll show that to you here. All right, so if I'm going to use, let's say I'm going to go on this side right here, I'm going to call this ulnar side, and there's the bone is right through here, but I want to hit right along through here. All right, so I'm going to use a little bit of massage lotion here. That's about it right through there, right? I didn't get a giant glob, just enough to be able to just coat my finger and slide across, and that's all you need to do, okay? So therefore, if you were to do only elbow massages using this entire tub, this tub should probably last you like a lifetime, all right? That's how little you're using, okay? If you're using it after like 10 applications gone, you've done too much. All right, here we go. So I'm going up and down this line right here. If my fingers are here, the bone is right through here. So I'm either gonna get my finger, which I like to overcross, right? Because if you use one finger, you can get really tired really fast. So I can either do this or this, right? I'm gonna do this here. And I'm going to dig in and slide. Now, I wouldn't be surprised if you hit some spots that are pretty tender, all right? You wanna get a nice deep purchase, but you don't wanna sit there and just crank away and push super hard, right? You wanna get in so you can get into the skin with a firm pressure, but that's about it, right? I don't want you to think that causing more pain means it better. That's bro science. I don't want you to do bro science. You might hit a spot that hurts. If it's a little bit more of a slight sharper pain, stay there for a little bit. Stay there for about 5 or 10 seconds and then keep sliding. And if you hit another tender spot, I got a little tiny tender spot right here, stay there for a little bit. Keep going. You want to go all the way until you hit to about right through there, because that's where the bone roughly ends. All right, so you want to do a couple different strokes. You also want to do it in both directions. So if I go from hand to elbow, think about going from elbow to hand. Sometimes going the other direction, you'll find new spots that hurt. You gotta remember that muscular restriction is not solely location-wise, but also it can be directional, meaning if you pull in one direction, you might not get so much of a purchase on that muscle or that knot, but you go in the other direction, it might be a little bit worse. Now, let's say that these fingers start getting tired because you've done that a couple times, right? Because you're not used to doing this. Another thing that I can do is make a little knuckle, and I can push in and this. This is a lot less finger tiredness, but some people like to do it one way or another, right? So that's one area here. The other area will be along the bony part of the radius, okay? So again, you don't see any like the globs right through there. I'm gonna run that along here. There we go. I'm gonna use the knuckle technique this time, and I'm gonna go right along the inside part of that bone. I got a spot right here. I'm gonna hang out here for a little bit. Once you hit that spot, maybe you wanna come back, roll over again, see if it's still pretty bad. All right, so I'm gonna go past that. So anywhere you feel some tension, go ahead and stay on it for a little bit. So you wanna go from here to about right through there, okay? So those are the two lines I want you to think about on this part of your forearm for the finger flexors, all right? Remember, these muscles attached to the inner part of the elbow. So then if we flip around, now you wanna do the outer part. So it's essentially the same thing. Radial part of the arm, you're gonna run your fingers right through there. This time I'll do the overlapping finger technique. And you want to go all the way along. Good, okay. And then I'll do the ulnar side, which is more through here. Same rules. Now, I wouldn't be surprised if this side might be worse than this side, or vice versa. All right. One thing I want you to think about is if you have your hand here, you got to remember that the radius attaches to this point right here. So this bone actually is going to, if you have it here, it's pretty straight. But once your hand comes down, it almost kind of goes more of a diagonal. So you got to make sure that when you're going, you got to feel along that bone. It's going to come up through here. But if you have your hand up here, it's going to be more of a straight line. Hopefully you can feel with your fingers and like a harder bone part, and you get an idea through that. So what I want you to do is think about doing this for a couple of minutes. This line, this line, this line, and this line, right? Then you might want to combine it. I'm a bigger fan of doing the soft tissue work first and then trying to move joints afterwards. So then you can do my other video where I show you how to try to move the radial head to try to get this moving a little bit better. And that's a little bit more specific towards tennis elbow, but it should be able to help out the golfer's elbow also, right? And so I also wouldn't expect you to have immediate results. You're gonna have to do this for a couple weeks before things start feeling better, right? Because what you're trying to do is you're trying to promote the healing process. And that healing process takes time. It's not an immediate change, right? But I want you to try and do that on yourself. And you gotta remember that also, that especially if you're an avid athlete, weekend warrior, if you're having elbow pain, you're probably going to have some other issues going on the shoulder also, right? So just because you have elbow pain, you work on the elbow, it doesn't mean that you've gone to the source of why you're having pain. There might be things going on the shoulder, but that's another story. That's another video, guys. All right, if you like this video, please like and subscribe. And if you have any questions, just go ahead and shoot me a comment. I like to see what you guys are thinking. All right, thanks.